The pandemic entered Portugal early in March this year. Early in April, we had mobilized IGC's infrastructure, equipment, reagents, and more than 40 volunteers to help society face the Covid-19 challenge. There was a need for personal protection equipment. We had stocks, and we made donations to the health system and to the pilot. There was a need for performing large number of diagnostic tests to identify people undergoing active infection. We implemented such tests using alternative reagents. During the first wave, we performed 10,000 diagnostic tests to help neighboring hospitals and nursing homes. One of our scientists also spent 3 months full-time helping on-site at a diagnostic lab in a hospital. Our protocols have been shared, notably with the pilots, in packages including video tutorials, equipment, and reagents. There was a need to monitor the progression of the epidemic in communities and at the national level. To address this, we partnered with several academic centers. We developed a serology test that measures antibodies specific to the virus and thus allows to identify people who have been infected over the last 7 months. We also designed a method to conduct randomized surveys or large populations. At IGC, we performed 8,000 serology tests, notably to monitor the progression of the epidemic in healthcare providers. The need for diagnostic tests is still acute today, and we are currently developing more practical, faster, and less costly tests that rely on self-collection of saliva. There is still a need to identify who acquired protective immunity from infection and reinfection. For this, we are currently developing tests that detect whether the serum of an individual can neutralize any of the virus variants that circulate in the world. While many vaccines are being tested worldwide, their success is still uncertain, and exploring all possibilities remains a necessity. IGC, in collaboration with TKB Nova, is exploring alternative vaccination strategy that targets specific immune organs. On the research ground, IGC investigates what are the biological reasons for which some people develop severe COVID, while others remain asymptomatic upon infection. We hope to identify biological indicators, genetic or immunologic, that predict disease severity before it takes place, to favor earlier medical intervention, but also to guide therapeutic choices. On the virus side, IGC investigates what are the potential and effective mutations driving its evolution. And we hope to anticipate the virus progression to more, hopefully less, virulent forms. Together with hospital centers, we will continue our efforts to address the societal challenge imposed by COVID-19.